It is the response strategy organized by NOI Polls, and like I said, you're welcome. On this edition, we are going to be looking at COVID-19. We're looking at the response, we're looking at concerns and the progress in Nigeria. I want to welcome everybody. I can see Dr. Bamidele. Good morning.
Good morning.
Good to have you here. Yes, I can also see Professor Iwala. Good morning, sir.
Morning.
Thank you for bearing with us. I can see Dr. Ochu. Good morning, ma'am.
Good morning.
Thank you for waiting up for us. I can see Faith Onyebujo. Good morning. Okay. Essien Esieri. Thank you for joining us. Tope Durojaye. Thank you for. It's a long list. So I want to say thank you again for waiting up for us. So we're going to cut to the chase. We're looking at COVID-19. We're looking at the response. We're looking at concerns, and we're looking at progress. But on today's edition, we're really going to be focused on the vaccine. Prior to having that vaccine conversation, we're going to do a background, which Dr. Fisayo and Dr. Chu would help us with. Before we go into that, the coronavirus pandemic has actually ravaged, the world for, I think, a little more than a year since the first case we had in Wuhan. Our index case in Nigeria was sometime in February 2020, and it brought a lot of fear and confusion, to not just Nigerian, but I think it was a global issue for everyone. We were as confused, as the rest of the world, mostly because it was novel, and that's for a reason. The reason for that is the possibility of a vaccine wasn't going to be at sight anytime soon. Anyway, the good news today is that despite, the fear of what we call now the second wave and, a possible new strain of the virus, there are available vaccines already being administered in some countries, and that's good news. Ironically, regardless of this good news, there are concerns about issues on both, the second wave and issues around the vaccine use, especially in Nigeria. A lot of these conversations are going on globally, but this is one conversation we want to have today, especially with regards to the vaccine. So it will actually form the bane of what we're going to be talking about today. So we're looking at response, we're looking at the concerns generally, and we're looking at the progress in Nigeria. And we have professionals in the house who will be talking about this. We have Dr. Chinwe Ochu. Dr. Chinwe, thank you for being a part of this. I want to be sure I'm here. I can hear Dr. Chinwe.
Yeah, thank you for having me. Can you hear me?
Okay, yes, I can hear you. Yes, I think I'll just boost the sound from my end. I'll just boost the sound from my end, but I can hear you. Also, we have Dr. Fisayo Bamidele. I want to be sure you're here.
Yeah, I'm here.
Oh, thank you so much for being here. Also, we have Professor Emeka Iwala. Thank you so much for taking out time to be here.
Thank
so
you
this is
for
sound check.
having
I want to be sure he's there. Thank you so much, sir. All right, we're going to start. But, prior to starting, let's just run through our discussants. We have Dr. Chinwe Ochu. She's a medical doctor. She is Acting Director, Preventions, Programs and Knowledge Management and Head of Research at NCDC. You are welcome.
Thank you very much.
Also, I have Professor Emeka Iwala, who is the Director, Covenant University Center for Research, Innovation and Discovery. He's also a professor in biochemistry at Covenant University with active international research collaborations with the investigators at the National Cancer Institute, National Institute of Health, and the University of Florida. Professor, you're welcome.
Thank you very much.
I also have Dr. Fisayo Bamidele. She is Senior Resident Doctor, Department of Community Medicine and Primary Care Olabisi Onabanjo University Teaching Hospital. She is a public health specialist and has participated widely and actively in the COVID-19 response, volunteering at the isolation ward within the teaching hospital from March 2020 till date. So I'll run straight to the questions. I will start with Dr. Chinwe because I want her to do a background for us. First, let's look at it from how we managed the first wave. Dr. Chu, would want you to help us very briefly do an analysis of how we, Nigeria, managed the first wave of the corona pandemic.
Thanks, Nelly, and good morning, everyone. I'm happy to be part of this discussion. I think Nelly has laid a very good background. COVID-19 has disrupted our lives in so many ways. And by this time last year, little did we know what was ahead of us. We were all expectant. At the Nigeria Center for Disease Control, we're already responding to another serious outbreak of Lassa fever, but we didn't know that something worse was yet to come. By early last year, January specifically, the news was going around the world about this novel virus that was discovered in Wuhan. And the whole world was still grappling with it because being novel, there was a lot of ambiguity around it, so many things that we didn't know about it. All that we knew was that it was spreading quite fast. And from being localized in Wuhan, it's spreading to other cities, and then through international travels to other countries. Eventually, it was declared a pandemic by the WHO. Before then, we started working because thankfully, as a country, we already had an incident management structure in place that helps us to gather epidemic intelligence and identify public health threats and respond quickly. We had an emergency operations center that was already responding to Lassa fever. So when we started hearing these, what was observing the global trend, what was going on, as early as January, Nigeria set up a national COVID-19 preparedness group that was started planning, developing SOPs, guidelines, training, trying to identify possible laboratories that could test for COVID, treatment center, and co. And then there was also an interministerial committee that was set up at that higher governmental level. And a lot of all this was happening. Risk communication materials with information and education communication materials were being developed. The pandemic preparedness plan, influenza pandemic preparedness plan, we quickly brought it up and we completed it, hoping to activate it for this new virus that we didn't know, but that was more like influenza-like, so to say. So many activities already happening. And point of entry surveillance was set up. We had this temperature that we were using because of the existing outbreak of Ebola in DRC Congo. So that helped us in screening incoming passengers from other countries. 27 February, we had the first case of COVID-19 in Nigeria that was detected. The next day, that preparedness group was transformed into an emergency operations center, a multi-sectoral emergency operations center. And we launched this all of society take responsibility approach because we felt this was an outbreak that was so ambiguous and dependent a lot on behavioral factors. So there was need to communicate behavioral change. And this COVID-19, just like any other infectious disease, cuts across various sectors. It's not just a health sector problem. So we did that analysis and we launched the Take Responsibility campaign of risk communication, where we made everybody, all sectors, including the private sectors, including the individuals, communities, different organized groups, to know that everyone is responsible for controlling this outbreak. We also ramped up our testing capacity by establishing new molecular laboratories. At the beginning of the outbreak, we had just 3 laboratories that could test out of the 5, but currently we have 69 public health laboratories and 31 private and also corporate laboratories. We quickly put together a treatment center. When we had the first case, it was only the infectious hospital Yaba that could treat. But currently we have over 100 of treatment centers in the country. We supported the states by deploying rapid response teams to the various states. As they were recording cases, we were sending this team to support the states, to build their capacity, to help them set up an emergency operations center. One fantastic thing that happened was that most of the states, minus just 1 or 2, were able to activate an emergency operations center. Before the outbreak, we had just about 21 of them, but now we have 35 plus 1, the FCT, with an active functional emergency operations center structured like the national center. So that's a very big thing for us. We also, prior to this time, we had a digitized surveillance tool we call SURMAS, Surveillance Outbreak Response Management and Analytical System software, that we're using for real-time documentation of data, both from the field, right from the field to the national level. So as people at the field at the various states, they are detecting cases, those DSNOs, they are imputing it into SURMAS, and we are seeing it real time and it's displaying on our dashboard. So that helped us to have real data to monitor the situation and to act quickly. Our strategy was to detect early detection, isolation, treatment, and contact tracing. That was what we did. It was an aggressive risk communication strategy that was developed. So all these were deployed last year. And I'm happy to say that this year we feel a bit more confident because we are better prepared. There's so much we know about the infection now. All the ambiguities are beginning to clear up. And like you rightly vaccine on the horizon, so there seems to be hope. Okay, the problem let me just round up by saying that the problem we have to deal with now is lack of community risk perception, very low community risk perception, with complacency everywhere, and difficulty in people adhering to COVID-19 protocols of social distancing, physical distancing. We later corrected it to physical distancing, wearing of face masks, hands frequently, and respiratory hygiene. So that is what we are ramping up and strengthening these preventive measures. That's the approach we're using for this second wave. I just try to summarize it.
Okay, that was what that was what I wanted to ask. I wanted to know how much Nigerians have actually complied with, the pharmaceutical procedures and the preventive measures. And like you had said, there's a lack of community risk perception, and people are really not complying. Could that be a reason why we are observing the massive spread that we're having this time? And could that also be a reason for, say, a second wave? Could you just briefly tell us about this?
Absolutely, you got it right. Is the intervention we have been using is a non-pharmaceutical intervention, because up till now, we still do not have a concrete evidence to support the use of any specific treatment that can cure COVID. So a lot depends on breaking the chain of transmission through the use of those non-pharmaceutical interventions. You see, when this whole thing started, we've seen variations in community perception. Initially, we had this outrage, anxiety, people were afraid, so they were more willing to listen to you and do whatever you said at that first phase of the outbreak. But subsequently, because we were not having as many cases as other countries were having, what we look at as the COVID paradox, We still do not understand it very clearly now, why Africa seems to be having fewer cases and fewer deaths compared to the rest of the world. Of course, we have other factors like we're not testing enough and so on, but after all has been put into consideration, we are still having relatively fewer cases and fewer deaths. So that made people to relax, and they're beginning to doubt with a lot of conspiracy. Could it be that the government is trying to deceive us? They are trying to make money? Because over time, people have lost trust in the government. They don't even believe you, whatever you're saying, when you're saying the right thing. So all these whole things came together to bring about this communal complacency towards adherence to the NPIs. And that is definitely the reason why we're having the second wave. And this second wave seems to be even more aggressive than what we had the last time. So that is the issue we're having to deal with.
All right, thank you, Dr. Chinwe. Let's I want to push it to Dr. Bamidele now. You have worked at the isolation centers, and I'm sure from when this started up until now, I suppose. Can you give us your experience very briefly? Can you, let's even have an experience what the isolation centers, were and are now, so that we have an idea of probably how good or how bad things are. I for lack of, for want of words, just do us a little, give us a little experience of what the isolation centers are now. Just paint us a little picture.
Okay, thank you for having me here today. So when this pandemic started, I think that was December. The first case in Nigeria was in February, like Dr. Uchu said. And so when we had the first case, of course, we knew at my center that it was a matter of time before we had in our state, which is Ogun State. And so, of course, the emergency response team was activated. And then in my hospital too, there was a response team within the hospital. And then we started looking for volunteers. And they started looking for volunteers, and so I volunteered. One of the reasons why I volunteered was because I had had a previous experience in management of Lassa fever some years back. So when they asked for volunteers, I was willing to work in the isolation center. And so by mid-March, we had our first case. The first case, of course, before was a bit difficult for getting the patient into the isolation ward because, of course, the patient probably didn't believe he had COVID and was of the opinion that they were just trying to use COVID to bring him into the isolation ward. It was we had to do a lot of talking and all that. But eventually that was the first case. And then gradually we started having more and more cases. And then we had to look for more people to join us because we started getting overwhelmed. Of course, the cases increased as the days went by. And then up till, I think, about June, July, the cases were still increasing. For us, working with the patient in the isolation ward, was an experience like we had. The major issue we had was that a lot of people didn't believe that they had the COVID-19. They just felt that we had people that felt that maybe it was some of their relatives that wanted to get them out of the picture, and that's why they were telling them that they had COVID-19. We had those kind of things. We had patients that were depressed when they finally understood that they had COVID, and we had to, apart from the clinical support that we're giving to them, we also had to, talk and counsel and bring in other people to talk to them. And also, we also had patients that became violent. Okay, we had people throwing things at us. We had people almost beating us up while on the ward because of all this, and some even attempted to run away. But in all this, one thing that was very, very positive was the fact that we had enough PPE to work with. We had things to work with. We had things to protect ourselves. We did not attend to patients without PPEs. And our superiors, people that were in charge, they made those things available and they supported us. Those are some of the things that actually made us, at least for me, that was one of the things that made me keep working there because I had support from my superiors. When we needed PPEs, they made it available for us. So it made it easier for me to keep working there. And towards the end of last year, the cases declined. And then late in the year, we started having more cases. And the cases are increasing again. Like we all know, it seems like the second phase is really here, and the cases are on the increase.
All right, we're going to push this to Prof. But just before we get Prof in to talk proper on vaccines, I also want you to also look at this issue of transmission, especially amongst young people, children. I'm particular about children. You're a doctor, so probably I'm sure you'd have this kind of cases. Now the Lagos State government either yesterday or this morning, released a press release saying that the school resumption would have to be on pause until they come up with some other guidelines or some other protocols for resumption. So the case of children, resuming school is a big issue. I want to know, with all of this transmission, with all of the sickness and the treatment and all of what has happened with this, what is the transmission rate amongst young people? And when I mean young people, I want us to add children to them. What is the transmission rate like?
From what we know that children they are really symptomatic, even if they are positive for COVID-19, even if they have COVID-19. But they are rarely symptomatic. Despite that, they do well.
Explain that again.
Meaning that, oftentimes they do well, even if they have the COVID-19 virus, they may not have severe symptoms, or they may not even have symptoms at all, And even for the ones that may have symptoms, they recover well, But the issue is that despite that, they can transmit it to other people. And so you can have a child that is doing well, that has COVID, but lives in a house where he has somebody that is elderly or somebody that has other comorbidities. And then the elderly person or the person with comorbidity picks it up from the child. And then the elderly person or the person with other diseases like diabetes, hypertension, and then that person may not do well, after contacting the disease. So even though you may say that children you don't have a lot of statistics, a large number for children that are dying from COVID and all that. But the fact is that children can transmit the disease to other people. They can transmit it to the elderly. They can transmit it to other people that have other underlying medical illnesses like diabetes, hypertension, and other diseases. And as a result of that, we may have increased morbidity, increased death from COVID-19. Because of transmission from children.
All right. Thank you very much, Dr. Bamidele. Now I push this to Prof. Prof, I'd like you to, you're going to be talking more about the vaccine, but prior to that, I would like you to talk on, immunity. What role does immunity play in issues of infection and transmission? Isn't this a worry for, large-scale infection? Prof, I'd like you to talk about immunity when it comes to COVID-19 transmission.
Okay, thank you very much. And I also want to relate with the two previous speakers, especially commending the response of Nigeria, towards the COVID-19, which is commendable, especially when you consider the environment where we are also operating in. In terms of immunity, just in a layman's term, we have what we call natural immunity, which is our ability to fight infections when they come into the body. And these infections include, things like viral infections, bacterial infections, and the like. We have what we call the innate and the adaptive immunity, but I wouldn't want to, go into the technicalities of that. The take home here is that our bodies are built in such a way that they are able to naturally fight infections, such as viral infections, including the COVID-19. However, sometimes our body's immunity may be overwhelmed by these infections. So it varies from persons to persons. Some persons may have strong immunity and they will be able to fight off or ward off this infection naturally. And some persons may have some level of weakened immunity such that they are not able to fight off these infections. So what our body does is that when these infections come into the body activates the immune system, through the release of antibodies towards these infections. And over time, these antibodies begin to build what you call memory cells. And these memory cells, when they come in contact with these infections again, they can be able to, put them in check. And that is the basis of COVID-19 vaccines. It is actually based on the science of immunity and also as well as science of infection.
Okay. Having said that, now we hear about the second wave, which is, what everybody's talking about. We're still grappling with the first wave, whatever that means. And now they talk about, a second wave. Can you please explain what this second wave is about and whether or not we should be worried that there's a second wave? Because if the first wave is as scary as it was, what exactly is going on? And then there's also this issue of for 9 wave, or this is, we're having this because we probably haven't tested enough or probably haven't done this enough. And this was actually the first wave which hasn't been, properly dealt with. What exactly are we looking at?
Well, you can agree with me that the first wave did not generate a lot of concerns as this second wave. And I want to believe that the second wave that we're experiencing now may not be far from the issue of a new strain of the virus, which, we have reports about new strains of the virus in certain parts of the world, including UK and South Africa. Although the presence of the new strain has not been confirmed here in Nigeria, but I know that there are several scientists in Nigeria who are working, towards determining if we have a new variant in Nigeria. But naturally, the way the virus behaves is that because of transmission from person to person, the viruses, have this ability to change or to mutate into variants that can change the course of infection. However, I think the second wave that we're experiencing may not be far from the prevalence of new mutants of the virus, which is highly transmissible and which can also, maybe cause more serious infections than the first wave. And also, in addition to that, like the previous speakers have said, compliance with non-pharmaceutical preventive measures by Nigerians, including wearing of masks, including social distances, may also have contributed, to the spike in the second wave, because Nigerians largely have not been compliant, with these non-pharmaceutical measures of preventing the spread of COVID. I think we need to focus on reducing the transmission of these viruses and also reduce the possibility of generating new mutants from the virus. And we can only do this through the measures that have been put in place already by ramping up massive testing, by supportive isolation for people who are infected, by tracking and contact tracing, and also by quarantining all contacts that have been identified to have contact with people that were infected. And also the other ones like wearing masks, avoiding crowded places, and also avoiding closed settings, washing of hands, respiratory etiquette, and all the rest of them. If we can stop the transmission of this virus, I think we can also break the possibility of the viruses mutating into some other variants that will be highly transmissible and be more virulent.
Okay, Prof, thank you for that. I'll come back to you in a bit, but I'd want Dr. Chu to pick up on this. You talked about transmission of the virus. Dr. Chu, how has it been recently in terms of transmission compared to how it started earlier? If we look at it, let's say we agree with it, it's the second wave. In terms of transmission, how bad is it now?
Okay,
Dr. Chu,
yes.
you can hear me?
Can you hear me?
Yes, I can.
Oh, can you hear me? Okay, great. So COVID-19 has always been a highly transmissible virus, and we've established the mode of transmission, which, like Prof said, is mostly human. And a lot depends on people coming in contact with infected cases. When we transited to community transmission from sporadic cases that we're having from imported cases at the initial phase of the outbreak, our strategy has been to limit as much as possible people contact with the virus from others that have the infection, or even from surfaces. The mode of transmission has not changed. It's still droplet infection gotten from either somebody that has the virus sneezing or coughing or speaking, and the droplet getting to another person that doesn't have the virus, or somebody contacting it from surfaces. We had an intensive response at the initial phase of the response, and we saw the usual first wave. We went to the crest and we started coming down. At that point, there was a lot of relaxation. A lot of people felt there was no COVID in Nigeria, even if there was before that had gone. So go to markets, public places, you see people, they were not wearing face masks, no form of physical distancing, even religious groups, churches and mosques where they were wearing masks before, people started removing their masks. And to complicate matters, there was Christmas. People had to move a lot of travels across the country from one state to the other, and from carrying the virus from the urban area to the rural area, and then coming back from the rural area to the urban area. So with all this intermingling and everything, we're not surprised that we started having increasing number of cases. We actually,
which means apparently there's a spike.
Yes, so the spike started coming. Well, it's possible we have a new strain. We're still trying to demonstrate that in the country, even though our sequencing capacity is not as it should be, because sequencing is a very expensive procedure. But what we have done, we've not been able to demonstrate that this transmission is from the strain. That doesn't preclude the fact that it could be the cause. And if we strengthen our sequencing measures, maybe we can pick one or two. But the one we know for sure is a flagrant disregard for public health intervention, public health measures. This non-pharmaceutical intervention is contributing to the spike that we are having. Even as we are talking now, people in the market are still not wearing face masks. People are still having large gatherings. Burial ceremonies is still being conducted without observance of these preventive protocols. Marriages are happening and people are still, crowding and not distancing themselves as they should. So yes, the awareness is improving a bit because the numbers are rising, but it's still not where it ought to be. And there is no hard and fast rule about it. So long as people keep intermingling, the virus will keep spreading from one person to the other, and we'll keep having increasing number of cases. We have not established scientifically for now in the country that the new strain is causing the higher transmissions that we're having. That doesn't mean that it might not be contributing, but we don't have evidence to support that yet. We are hoping that we will strengthen our scientific processes to make that detection if that's the case. Thank you.
All right, thank you very much, Dr. Ochu. I'll move this back to Dr. Bamidele. We see from what Dr. Ochu have said, apparently there's a spike. How has this actually affected, patronage of healthcare facilities? Because we know that when the whole COVID drama started, a lot of people were afraid to go to the hospitals and all of that. But with all of the relaxation, is it yet business as usual? What is the patronage generally as regards patients turnout at healthcare facilities?
Well, I don't have facts to support that, but I would say that from my own experience, people are still a bit skeptical about going to the hospitals. So you find out that you have a number of people that are, even amidst people people that are they are not feeling fine, or people that are not well, but do not want to present in the hospital because they think that, or because they feel that if they go to the hospital, they're going to be tested for COVID, or the first thing they will tell them that they have COVID. Okay, so I think people are still not going to it's still not business as usual. People are still a bit skeptical about going to the facilities, even up till now. And so you have people at home treating themselves, people that have symptoms, they treat themselves, they don't go for tests. So they're at home, they're not going to the hospital like they would have gone if it was like 2 years ago. So I think it hasn't, that aspect hasn't gone back to normal.
Let's have Prof explain to us, what exactly is the vaccine supposed to do? Is it preventive? Is it curative? Is it a one-off? Do we need a single dose? Just help us lay a foundation of, what this is about, and tell us how the vaccine, the COVID-19 vaccine actually works.
Okay, thank you, Nelly. Let me start by saying that this is not the first time we're hearing about vaccines. Vaccines have always been there. We have vaccines for a lot of diseases, such as measles and even polio, which is a viral infection. So I don't know why we have all these reactions, coming up because of the COVID-19 vaccines. But let me state here that vaccines are actually developed to help to build immunity, to viruses that cause infection. So the main action of vaccines is to help stimulate immunity against viruses that cause infection. And they do this by stimulating an immune response, which we call the antibody antigen reaction. This immune response can either be antibody mediated or cellular mediated, and it is usually directed at the virus. Most times it is directed at the components of the virus. Like we know, if you look at the structure of the virus, it is covered by what we call the X protein, the spike protein. So when these viruses get into the system, the body initiates an immune reaction, towards these spike proteins by producing antibodies, stimulating antibodies that can act to inactivate these viruses. Normally we have, various kinds of vaccines. We have what we call the whole virus vaccines, which may be the live, virus, or the inactivated or the attenuated virus as it is. These live viruses are usually put into the system as vaccines to stimulate immune reactions, towards the viruses. But the risk in using the live viruses is that they can also cause their own infection. So most times, live viruses are usually not used, but we use what we call the attenuated viruses or the inactivated viruses, which is the inactivated form of the virus, but that can still elicit an immune reaction, towards the virus. Then we have what we call the protein subunit vaccines. These are, vaccines that involves the use of certain proteins that are part of the viruses and which can stimulate immune reaction. But this type of viruses usually stimulate a weak form of immune reaction, and they may not be actually effective. And then we have what we call the viral vector vaccines, whereby we use a virus that is not too infectious and use it to encapsulate the virus and then introduce it as a vaccine. But this one is also risky because the vector that is being used in carrying the vaccine can also, give additional infection. But howbeit, the last one is what we call the nucleic acid vaccines. And this seems to be the new technology that is underlying the COVID-19 vaccines. This includes the use of DNA or RNA, basically the messenger RNA. What these viruses do is that they are created based on the molecular structure of the virus. Okay, so they are not the real viruses, but they are created based on the molecular structure of the virus. So they won't have any negative effect, as it were. So what these mRNA viruses do is that when they get into the body, they can begin to use the cells of the body to produce the spike proteins of the virus, which can now elicit immune reactions. And in the course of time, the body can begin to generate immune response to those viruses. Let me state here that the global fight against COVID-19, has seen an unprecedented collaboration and effort towards coming up with a vaccine. Prior to now, we have not been able to come up with a vaccine for coronaviruses, even though scientists have been working, towards that for a long time. But I'm amazed at the speed at which you have been able to come up with one because of the new technologies that are available, and also because of the pandemic nature of the virus. A lot of scientists went into their lab and began to have collaborative efforts, to come up with a vaccine. And let me state here that the process of making vaccines is a very restricted and clearly monitored process. We have what we call the preclinical and the clinical studies. And these studies are aimed at ensuring that these vaccines are not only safe, that they are also very, very effective. So these studies are carried out in animals and also carried out in humans and in real patients, and they are monitored over time to ensure that the vaccines are safe and that the vaccines are also effective. So that is a little bit background on the COVID-19 vaccine. And I'm happy to say here that about more than half a dozen vaccines have so far been approved for use by patients. And this includes vaccines from China, Europe, Russia, India, US, and some other countries, including the Pfizer, BioNTech, Moderna's, and all the rest of the vaccines. So to me, that's a wonderful news, and it is unprecedented, in the history of vaccines. With the speed at which this
you've actually done, helped us a lot with this. You've helped us cover a lot. We're going to take questions, a lot of questions already, and we're going to take questions in the next 2 to 3 minutes. So we'll read out the questions, and if there's anybody else, we'll open it so that we can take a few questions. We know there are a lot of media people who are listening. You talked about, the speed at which, these vaccines were produced, which is, not the usual thing we see. Isn't this a reason for the fear people, are coming up with, saying, what about, the side effects? I mean, how are we sure that this thing, will be as effective as it should be, considering the speed at which a vaccine, was put out? Like you said, there were a lot of, collaborations and all of that. However, there is still this skepticism about, this whole the quickness, as it were, for which these things, in terms of the timing within which this thing, came out. So I need you to talk about this in 2 minutes so we can take, as many questions as we can.
Okay, thank you very much. I don't see that as a concern because what we have at hand is an emergency situation, the pandemic. And the emergency situation requires an emergency response. But that does not mean that the rigorous process of producing vaccines will be compromised. That aspect of vaccine production can never be compromised. And that is what I mentioned before, the preclinical and the clinical studies. Before any approval can be granted for a vaccine, it has to be ensured that both the preclinical and the clinical aspects of the vaccine productions are fully complied with. And I'm sure that the vaccines we have now complied with all these preclinical and clinical studies to assure safety and efficacy of the vaccine. So the speed at which it was developed has to be a response, to the emergency situation we had at hand because of the pandemic. Besides, there are various layers of approvals that vaccines must have to go to. People will have to, do what we call a clinical study. Those people have to be followed up. They have to be followed up to check for efficacy, side effects, and all the rest of them before the approval process can take place.
Okay, thank you very much, Prof. Let me just run through. For those who want to participate, if you have questions, can you just signify, send me a chat message, but I'll read the ones up already. I think they're either questions or just comments. This is from Bernard. So if you're there on...
Yes, I am.
Okay,
not a question. I just thought I should contribute to the conversation that is going on. And that is to confirm that the current new wave was predicted because closely related viruses are known to have a spike in the cold winter months in Europe and America. And once you have that spike, you're likely to have some of that transported to other countries. So that's part of why there's a new wave. And secondly, a recent, study, conducted by people at King's College, London, and collaborators in China also confirmed that the dry air increases the severity and the ease of spread. And so that may be contributing to the situation in Nigeria.
All right, thank you so much, Bennett. I appreciate your contribution. Also, we have Maruf Zalikat. Can you please, your question? You have a question here, but I'd rather that you just come on with your question.
All right.
Maruf, can you hear us?
Yes, I can hear you. Yes, my question was as regards the second wave. I'm not really sure whether the reason why we are calling it a second wave is because of the number of cases or rather the rate of spread. Because if we are looking at the situation in Nigeria, even Mrs. Chinwe told us that in Nigeria we really don't. We don't really, the death rate is low, and the transmission rate is not as like other country. So I'm asking that what really qualifies this as a second wave, considering that even I read that the testing of there's a false positive in the testing of the COVID-19, considering that the PCR or whatever. So I'm asking that is it the number of cases that qualifies this particular wave as a second wave, or it's just that I don't really understand. That is why I'm asking actually.
Okay, thank you very much, Maruf. We'll get them to all the discussants to respond to this, but let's just take one or two more and we'll get them to respond. Thank you. We also have Faith Onyebujo. Can you please ask your question?
Okay, good morning.
Good morning.
Can you hear me?
Yes, we can hear you loud and clear.
Okay, so the question I have is, who gets the vaccines first in Nigeria? When we do get it to Nigeria, who gets it first? And how long before the vaccines are made available to the public? I also have a follow-up there that I'm concerned about a lot of myths we have around COVID-19. I mean, you have people saying stuff like, if you just take alcohol, it will take care of it. If you stay in the sun, it will take care of it. So what effort is being made to debunk a lot of these myths around COVID-19 in Nigeria? That's what I have.
And Bukola is here. Good morning, everyone.
Yes.
My first question was, will the vaccine be free of charge for everyone, or how affordable will this be? If it's going to be, according to that interview, you were asking, should it be made mandatory or not? If it's going to be made mandatory, should be affordable or free of charge? So I have questions around that. And the second question I asked was, usually, or from what I have heard so far, when they make vaccines, there's some element of the virus itself or whatever it's been vaccinated in the vaccine. Hope this vaccine is going to be safe for people with chronic diseases, underlying diseases that are mostly impacted by the virus itself. Hope the vaccine would also be safe for them. Thank you.
All right, thank you very much. From the conversations that has been thrown up and the questions that have been thrown up, can we just have Professor Iweala and Dr. Chu and Dr. Bamidele just talk about them very briefly in 2 minutes. Let's start with Dr. Bamidele, please.
Okay, I think I'll just talk about the issue of the vaccine and having effect on people that take it. One thing I know about vaccines is that for most organisms, okay, they have certain characteristics, which are ability to cause disease, ability to generate immune response, ability to cause severe disease. So for vaccines, I know that the ability of the organism
I think we've lost her briefly there.
That is being used, or the active ingredient that is being used, its ability to cause disease or severe disease is of that generate an immune response is what. Hello, can you hear me? Can you hear me?
I can hear you.
Yes, we can hear you.
Okay. So for vaccines, generally, we know that it's the ability to cause disease is no longer there. What is there is the ability to cause an immune response that will be able to protect the individual from having that disease. That is what is left. Okay. So that's what I wanted to say.
All right, we'll take this to Dr. Chu, but Dr. Chu, I want you to add to this. Let's look at publicity. I don't know if it's in the place of NCDC to put out publicity or advocacy, as it were, with regards, how people react to it. I mean, if we look at the video and a lot of the conversations that have been had, one thing we found out was, even from the poll we put out, people were asked, will you be willing to take the vaccine when it is readily available? And we had 61% of Nigerians who said they will be willing to take the poll. And you have another 39% who say they are not. For this 39%, these people are putting the rest of, those who are putting the rest at risk, as it were. So I want you to look at publicity in terms of what you're doing in NCDC and how much of it is being put out, how much of it the people know. Is it in your place to put out advocacy as regards COVID-19 generally?
Okay, yes. Let me say that the lead agency for everything around vaccine for COVID-19, including creation of community awareness and preparedness for the vaccine, lies with the National National Primary Healthcare Development Agency. That's the lead agency and I know they are doing a lot currently to prepare Nigerians for vaccine. They will be want to really go into details of what they are doing. NCDC is only supporting them. I'm also aware that they have a risk communication group that is working on this, because a lot depends on creating the awareness and reducing the risk of vaccine hesitancy in the population. So they will be able to. But the one I want to press, I think Maruf, I hope I called that correctly, asked an interesting question about what causes the second wave. Is it the number of cases of COVID or the transmission rate? I would say that is both, because they are related. Once you have high transmission rates, you have more people getting infected and the number rises. So what you will see that we refer to as the wave, if you look at our situation reports, you will see the epic curve where we put in a chart. We see all those bars of cases of COVID-19 that we're recording on a daily basis. So once the numbers keep rising, you will have that increase in the number of cases. You are ascending the slope until you get to the crest. Then from the crest, if the number starts declining, it will keep coming down. And let me also say that the waves that we are talking about, first wave, second wave, didn't start with Nigeria. We have that happening in other countries, and we're observing them even before the cold season came. So we saw that trend of having a spike in the number of cases, and then with intensified public health measures, it starts coming down. And then later on, there's this relaxation, complacency, and then the thing starts going up again. There are multiple factors that are responsible. But what it means is that more people are getting infected. That is why you're having that next wave. So that is, I don't know whether there's any other question that is for it from there, but
all right.
That's, I was
talking about all right. Thank you very much, John. Yes. All right. We're going to push this to Prof, and I want Prof to wrap up. But in wrapping up, Prof, I'd also want you to look at a conversation that is ongoing. People are saying, we're asking, do we have the wherewithal? I don't know if Prof, if I should be asking him these questions. Looking at the issues of vaccine logistics, do we have the capacity in terms of storage, for the vaccines across different levels, considering, what it takes to preserve it? Do you think that will be a challenge for the vaccine in Nigeria? So you'd add that up to the questions that were thrown up by the other participants.
Okay, thank you very much. Let me start with the last question you mentioned in terms of infrastructure to manage storage and distribution of the vaccines. This is not the first time, we have conducted vaccinations in Nigeria. And I want to believe that we have the cold chain infrastructure to manage storage and transport of vaccines in Nigeria. The only thing to do now is for governments to, show up whatever we have and make sure that they are still functional and active, so that when these vaccines come, we'll have the infrastructure to store them at the right temperatures, and also the cold chain, to move these vaccines to where they are needed. In response to the other questions, in terms of seasons and environment, I would like to agree with my friend, Bennett from the University of Nigeria, Nsukka, but there is no concrete scientific data or evidence to show that, these seasonal variations, could be contributing to transmission of the virus. And then for the question asked by Maruf, I want to believe that a spike, connotes both transmission, more hospitalizations, and also more reported cases of the infection. I want to also state here that we may not have the correct, the accurate figures of the cases in Nigeria, because of the type of structure that we have. Just like Dr. Janet said, most people do not present to hospitals when they are sick. So it may not be easy to capture such data. And also, we are not even conducting a lot of testing to identify those who are sick. So we need to ramp up, such processes like, massive testing. And in fact, if you ask me, I think it's possible to ask the hospitals to take it as a gold standard now, to begin to test people when they come into hospital for COVID. For now, most hospitals are not doing that. People come into hospitals and they are treated for malaria or bacterial infection, and they are let to go home and begin to manage the rest. So hospitals can adopt that as a gold standard to COVID test. And then who gets the vaccine and how long will the vaccine be here? For now, we are not even there to begin to discuss about who gets the vaccine, because the vaccine is not even here, to start with. We are not manufacturing vaccines for now, and we are going to be dependent on the ones that are going to be donated or imported or bought from outside. So, but for who gets the vaccine is also important for us to have that conversation. The standard that we have seen across the countries is that frontline workers, essential workers are usually the first to get the vaccines, and those who are vulnerable to the virus are also prioritized in getting the vaccines before you begin to talk about other people. In terms of myths, I want to say that Nigerians have been treated with to a lot of myths and disinformation and misinformation about COVID-19 and even the COVID-19 vaccines. But I'm also aware that we have a lot of Nigerians who are, who have information, correct information about COVID-19 and vaccines. The challenge is that most of us get the information from the wrong places, especially from the social media. Instead of going to the authentic websites of WHO, CDC, and NCDC, to get the right information. And that is why we have had a lot of myths, a lot of misconceptions about this virus. But like my fellow speaker said, it is important that government should ramp up awareness and knowledge. And this can be done through our leaders across all strata, including the political leaders, including the community leaders. They should help in creating awareness, the correct awareness about this. In terms of free of charge, I also want to support the speaker, the person that asked that question. Because of our economic situation and because of a non-functional national health insurance scheme, I also want to suggest that when these vaccines eventually come, it should be given to Nigerians free of charge because of their economic situations, and there is no functional health information, health insurance scheme currently in the country.
All right, Prof. We're going to wrap it up here. But just before we do that, let's just do 1 minute, strictly 1 minute. We'll start with Prof. Just wrap up this program with in 1 minute.
Okay, I like I said, I want to first of all thank you for bringing me on board to be part of this conversation on COVID-19 vaccines. And I want to use this opportunity to commend all the researchers who have put in the efforts to make sure that we even have a vaccine, that we can begin to experiment with. And also, like I said, we are not producing vaccines in Nigeria. It's important that our government should begin to look at supporting research funding, especially health research funding. Currently, the funding that we're receiving from government now is very, very insignificant, and it cannot really bring about the much desired effort we are going to see in terms of research on COVID. And I also want to inform Nigerians to, debunk all the myths associated with the COVID vaccine. They are not true, and they should get the right information from the right sources. Thank you very much.
All right, thank you. Thank you so much, Prof. We'll push it to Dr. Bamidele. Could you wrap it up in 1 minute?
Okay, thank you very much for making me a part of this meeting. I just want to conclude by saying that we should keep telling our people, our friends, those around us, that COVID-19 is real. People that have lost their loved ones, people that have had to suffer severe symptoms from this COVID-19 would never say that it's not real. So let's keep spreading the message that COVID-19 is real, and the vaccine is a good thing which we should all accept gladly. Thank you.
All right, thank you so much, Dr. Bamidele. Dr. Ochu, let's have you conclude.
So let me use this opportunity to appreciate all the frontline workers that have been in the treatment centers, people like Bamidele, that is a clinician, and all the others that are putting their lives at risk to make sure that Nigerians are safe, as well as the public health workforce in all the states who are going to the field and detecting these cases. Nigerian that has been compliant to these protocols and doing our best to keep the nation as a whole safe. A very big thank you to you. Is because of what you are doing and because of the faith we have in God and in our country that we have been able to get to where we are now. And let me encourage us to continue to take responsibility. Everybody has a role to play. The issue of debunking rumor is everybody's business. Once that social media message gets to you, if it is not correct, if you don't verify, you don't pass it on. That is the only way we can control and be able to overcome this current tide of the epidemic. Thank you so much.
All right, thank you so much. I want to say thank you to everyone that has been a part of this. Dr. Ochu, thank you so much. Dr. Bamidele, thank you so much. We're grateful. Professor Iweala, we're grateful to have you. We are so grateful. We hope that when we call on you the next time, you'll be willing to come. It's Response Strategy. We hold this every week, looking at our polls per week. So we hope that the next time you'll be available. And to all our participants, we've seen all of you. There's still a lot of questions we can't take. Time is against us. Essie and Esire, we can see you. Sunday Duntoye, we can see you also. Thank you so much. This is where we wrap it up. I want to thank the entire NOI Polls staff and management and the entire production crew. That's the corporate communications unit of NOI Polls. Thank you so much. Like we know, the coronavirus, is going to be with us for a very long time. Our responsibility is actually to, work out responsible ways, like we've talked about, responsible ways to live with it. That would actually mean adhering, to the COVID-19 safety protocols and regulations, but by also, making efforts to get vaccinated when it is made available. Bottom line is the responsibility of keeping ourselves and the next person safe is actually in our hands. Thank you all very much. My name is Nelly.